Hi, YouTubers. Welcome to Charlene Clark's podcast. Don't forget to like, share, and subscribe. Most of all, click the notification bell, and then you'll get all of Charlene Clark's videos.
You heard it, YouTubers. Welcome to Charlene Clark's podcast. I hope you will enjoy the show that I have for you. My guest for today is none other than Patrice Labeach, who is a charge nurse at the Emory Health Centre in Atlanta, Georgia. Patrice will be discussing with us in detail the importance of early detection and maintaining a healthy lifestyle in detecting and beating cancer. Patrice is also a certified medical surgical nurse and also a registered nurse.
Know about these different signs and symptoms and just be aware of what cancer is on a whole.
Okay, as we celebrate or not celebrate, October is observed as Breast Cancer Awareness Month. But I'm not so much just want to discuss about breast cancer. Tell us a little bit about cancer. What really is cancer?
Well, to begin with, cancer is basically when you have growth that's really not controlled. So basically, these abnormal cells take over the body. And so the cancer just basically starts growing, and like your body's normal control mechanism stops working. So then these cells that are abnormal just kind of get out of control. And a lot of times if people aren't going to the doctor for checkup and so on and so forth, you miss certain subtle signs. And it, because it's in different stages, so stages 1 through 4. And if they miss a lot of times, if people aren't following up, by the time they finally see serious symptoms, it's stage 3, stage 4, and at that point, it's really hard to control. Not saying you can never ever be successfully healed from one of those stages, but it's a lot harder to be in control of. So follow up. Your physicals are very important to go to.
Right. So cancer has 4 stages.
Correct.
Right, with 4 being the most detrimental stage.
Correct. It's basically it's everywhere. So it's in your lymph nodes, it's in your bones, it's in multiple organs. And at this point, you're targeting all these different areas. So it's a lot harder to manage. Like it's outside, it's in your bloodstreams. Whereas for stage 1, it's centrally located, so it's in one specific area. It hasn't reached anywhere yet. It hasn't spread to other organs, other lymph nodes. It hasn't broken outside of that cell, so to speak.
Who gets cancer? Who do we have a specific set of people, who is susceptible to cancer? Who gets cancer?
Every single body has a potential chance of getting cancer. It doesn't matter if you're the healthiest person in the world, if you do certain things, if you try to be, that's why it's so important for these physicals, because you could be extremely healthy, work out, eat healthy stuff, all organic food and so on and so forth. And you can still get it because it can be genetic. It's something that can cause anybody. Like it could even be your environment. It could even be something you eat that you didn't even know. It could be something that it just runs in your family, and if your family is notorious for going to the doctors and things like that, then you don't know. So it's not something that to look out for or be mindful of. Like with breast cancer, there's the BRCA gene, BRCA. If it's genetic, so a lot of people who has it, insurance are now at the point where they're like, okay, if you have this gene, the BRCA gene, they're even willing to let you go ahead and cut off your breasts in order to prevent the cancer. And so they're paying in certain cases if you have these genetic modifications, or these specific genes, they're at this point willing, because they figure being able to cut off your breasts or to get rid of your ovaries and stuff like that is cheaper than having to fight a cancer battle, because these cancer drugs are not cheap.
Right.
I remember at one point I even had, because I was also a chemo certified nurse at one point, and this chemo drug that I had to give, one bag was worth over $100,000 US.
Wow, wow, wow.
So it's extremely expensive. So a lot of times prevention is way better than trying to find a cure. So it all goes back to making sure you're going to make sure you first off you doctor find you check the reviews of your doctor. You're making sure this is a doctor that's known for doing well for people. You know, it's not just a doctor for the heck of it. Not a doctor that's getting pushbacks from pharmacy, because then that's going to put you in a whole different situation. But just make sure it's a doctor that genuinely cares about you and your health and actually loves what they're doing.
Great. Let us talk a little bit about breast cancer. I have heard that there is an age when you should, well, 40. 40 is the age that you should do your checkup, your mammogram for breast cancer. But I've heard of persons as young as 35 who has breast cancer. Could you enlighten us about the whole notion of breast cancer?
Yeah. Well, the thing is, it can be very aggressive depending on mainly actually your genetic makeup. And so we've seen cases where people as young as in their 20s are getting it, but it's mainly because of the gene, and it goes back to that BRCA gene that I was talking about.
Right.
A lot of times, like I said, if you had a family member, multiple family members who have it, it's going to come back. It's not a chance. It's a high chance. You have a high percentage of getting this, because typically the age, as they're saying, you should start doing annual breast cancer screening. So that's like mammograms and stuff like, and having doctor to, you can actually learn to do checks as well yourself in the shower. Lift your arm up and just check everywhere, even including under your armpits. But a lot of times the typical age typically is 40 to 44-ish, start anywhere around there. But if you know it runs in your family, and it's good to get genetic testing, especially if you had a family member who passed from breast cancer. If you get that genetic testing, it helps set a path for you to know, okay, let me do earlier follow-ups. They'll set an earlier program and plan for you. So you wouldn't be the typical 40 to 45-year-old, and you're probably going at the age of 25, for example, just to make sure that you're okay. Or, doing a setup for the gene testing, genetic makeup, or things of that sort to see if you have that gene, because it can be so extremely aggressive that it's important to just be aware of what's going on with your body, get in tune with your body.
I have also heard that there are certain types of products, that underarm products that you use, that can cause breast cancer. Is this true?
I have also heard cases where the aluminum in the deodorant that we use can cause this kind of issue as well. So I know that some research has shown that, and sometimes you're not necessarily sure of all the information that you're being given out there. So even me, for example, I have actually chosen to start using products without it, and I mean, it works just as well for me. It's not gonna hurt, even if you say, okay, you only use it if you're going out on a hot sunny day. Just try to minimize your use of things that you don't have to use. Especially if you're not normally a sweaty person. You don't necessarily have to use it because society says. If you're trying to avoid a smell or something, I understand, and just try the natural ones. Some of them are actually really good. It doesn't and they contain no aluminum, no sulfates or anything like that.
A lot of our women are afraid of the mammogram. Some say that it is very painful, and so they tend not to want to do it unless they really have to. You don't find women just going to get themselves checked up. They tend to do it at a point where something is amiss and they have to do it. Why is this heavy fear about mammogram? Could you tell us about the process?
Well, the process actually is a bit uncomfortable, but the way I see it is you're under a few moments of discomfort versus years of pain and suffering. It's because the machine itself, it actually compresses your breast because it's trying to pick up dense areas that have tumors and so on and so forth. So it's seeing these areas, and in order to see it, it has to it has to compress your breast as tightly as it can. And so that's how it picks up these dense areas. So once again, I said it's a necessary discomfort, but it's not forever, and it only lasts for a few minutes. So, and not just that, when you go for your physical, your doctor is also going to be checking for lumps and so on and so forth when you do your physical, when you do an annual physical, which is what everybody's supposed to be doing every year, unless you otherwise told by your doctor.
Does the size of your breast matter in terms of the discomfort that you will face? Does the size of your breast matter? I mean, if it's a bigger breast as in comparison to a smaller breast, is the discomfort does the discomfort vary based on breast size?
Not necessarily. It's just a matter of someone's tolerance, how they're able to tolerate the procedure. And another important thing is just making sure that everybody knows too. It's not just women get breast cancer. Men also get it too.
I was about to get there. Yes.
Yeah, men also get it too. And the thing is, society is so geared on telling women about this cancer and breast cancer, but then so men kind of has this stigma. They're kind of shy away from it because they're like, oh, that's only a woman thing. Right. But also the thing is, men can get it. And once again, it goes back to genetics a lot of times, especially with that situation, because that gene, it doesn't care if you're a man or a woman, you know. And like, once again, cancer doesn't pick a sex. You know,
right.
only like prostate, exactly. Only like prostate or ovarian and uterus, because obviously that's a man and woman body part. But besides that, no, it doesn't care if you're rich, poor, educated, non-educated, nothing.
Young, old.
Exactly. It does not matter.
Tell me a little bit about cervical cancer. The women are advised to do a yearly, well, it depends on their body and what is happening, but pap smear, can a simple pap smear test pick up the potential of a cervical cancer or something happening there, or there is something different that you have to do in order to recognize whether there might be something happening in the cervix?
Pap smears are extremely important because what it does is it picks up differential cells. The physicians can see this. They send them to labs and they get a better imaging of them. And another thing they link it to is HPV.
HPV.
Correct. Hence the reason they started with these vaccines, want to vaccinate the earlier your child gets. It's not just for, they even suggest boys get this vaccine as well, because the thing is, HPV can be passed sexually. So if the boy also has it, or the male, you know, it prevents him from getting it to pass it on to the woman. And there are specific genes that they've linked to cervical cancer specifically. So the cervical cancer portion, if you have these specific genes, there are certain things the doctors will try and do in terms of, they'll probably increase your screening, because typical, per the American Cancer Society, typical screen for cervical cancer typically starts at age 25. So those age 25 to roughly 65-ish should have a primary HPV test every 5 years. And obviously, if that's not available, screening may be done with either a co-test or combination of different things. So either the HPV test with a pap test every 5 years, or pap test done alone every 3 years, as long as you've had regular pap smears yearly. Because what a doctor will do is sometimes they'll have you come every year to make sure you're having normal pap smears, and like if you've had you've had normal for every, they're like, okay, we'll put it off now to every 3 years or so forth. But it's up to the doctor's discretion, and they'll give your suggestion. But typically, you need to start doing it. But with younger girls, especially, they should probably, once they start seeing their period, I'd probably say by age 16, they should at least see a gynecologist by then, just to get a physical by the gynecologist to make sure everything, your uterus and all of that area, is okay.
Oh, okay. What's the difference, Patrice? What's the difference between a thin prep and a pap smear?
The thin prep? I don't think there is a big difference.
Okay.
But I think you can mainly just put, you basically use it versus, it depends on, I guess, what you're trying to find. And the pap smear just goes all the way back to like the 40s, whereas the thin prep received like a US approval, and that was approved since like 1996. So basically it's how the cells are prepared for evaluation.
Okay.
Yeah, it's just like a different form of taking the pap smears. Pap test is the traditional form, and so they are obtained from you can get it from, they obtain like things from cells from the vagina, the cervix, and the cervical canal, and then they spread it on the glass slide. And whereas in the thin prep, samples are collected using a special brush that is immediately washed in a special fluid. So they just, yeah, so
they pretty much do the same thing.
Exactly. I guess I don't know if it's just a matter of physician preference, or if they're looking for something specific, they'll do one versus the other.
We don't want to leave a man out. And a lot of men shy away from doing tests for what's that cancer called? Prostate cancer. There is this big thing with our men. They don't want to do the test. Can you talk to us a little bit about that and how important that is?
It is extremely important. So important. And it's the test you're referring to. It involves a digital rectal exam. And what it tests for is testing for a prostate-specific antigen. You do all of that when you do this test. They do blood levels to check for specific things. A lot of men don't realize that once they have this prostate cancer, a lot of things change for them, even sexually. So it's like, okay, what for the female, the mammogram is a discomfort. The pap smear is also a discomfort. But with the men, this is your discomfort. And it's a moment of temporary discomfort versus years of suffering, like I said. And it's okay. When I have dealt with multiple men who have had to have prostate surgery in order to, if they had probably caught it earlier, they wouldn't have had to do certain things. So where they've had to have a Foley catheter, which is a tube inserted in the penis, and basically having it flushed continuously with IV fluids, having it flushed so it doesn't develop blood clots. And that's one of the big issues they'll have is blood clots, pee and blood clots. And so the different procedures that you have to go through, if you have prostate cancer, depending on the stage, can be pretty brutal, especially for a man and his ego. So I think the moment, you don't, and especially if it's at a far point, you might have to walk with the Foley bike for the rest of your life. And I'm pretty sure most men don't want to do that. So
exactly.
The question is, once again, the digital exam versus walking with a Foley bag.
Right.
If they catch if you're doing your physicals and you're getting these exams, a momentary time of discomfort is not worth. It's so much. It's worth so much more than you having to be in this constant discomfort, pain. I've seen the pain men are in when these blood clots occur and they have to be using these irrigation systems.
Right.
And sometime, in one incident, I've had a patient where between myself and two other nurses, we were taking turns trying to flush this guy's Foley so the clots will go away because it was so intense. Wow. So irrigating, and it's so hard and it's so painful.
Right.
Because they're feeling constant spasms basically in their pelvic area. That's not a really nice feeling at all, especially for men.
Right. Tell me about colonoscopy.
Colonoscopy?
Yes, colonoscopy. And at what age? Who does this? And at what age? And for what?
Well, okay. So for colonoscopies, this is basically a procedure where in most cases, you're typically drinking a whole bunch of fluids, typically 2 to 4 liters. And this is all between the day before and the day of the procedure. Or sometimes they'll put you on clear liquids as well, where you're only allowed to drink like tea, water, stuff like that. And you have to be using these fluids and things like that.
Right.
But you have to drink a lot of times this specific fluid, maybe 2 to 4 liters. I've heard that it tastes a little bit salty, but it helps to clear your system out completely. And so what they do for this is they start, they basically wanted to put a tube down to see your colon, see if they see any polyps or anything of that sort. If they see any, a lot of times you'll hear them refer to it as polyp clipping. And that's where they clip the areas to see if there is, they take it and they remove it to send for biopsies. And a lot of times
go ahead, sorry.
A lot of times they'll start regular screening at around age 45.
Okay, that's what I was about to ask.
And then they'll screen typically for up until the age of 75. And then for most people between the age of 76 and 85, the decision to be screened is typically based on the person's preference at that point, their life expectancy, their overall health, plus prior screening history. So that's why it's so good to have a screening history, because sometimes the older you get, the less you have to do. Right. And so people over the age of 85 no longer needs to get a colorectal screening. Typically, that's probably because your linings start to get thinner, and you lose that chance of perforations, and you don't want that on top of everything. So, yeah.
Right. So, in essence, proper screening, early screening and detection helps us to overcome cancer, to treat with cancer in the early stages, rather than being fearful of what the treatment is like, or should I say what the screening is like, especially for the men and the prostate cancer, and the women with the discomfort of the mammograms.
Exactly. And just as far as the colonoscopy, that portion, per the American Cancer Association, is every 10 years.
Every 10 years.
Every 10 years. So it's not even something you have to do every single year.
So 45 and then 55 for your second screening.
Yes.
Okay.
Just unless they see other things, polyps, and then they have positive readings on your biopsy, or if they've seen multiple polyps and they just want to continue to make sure it's not growing, it's not turning into something else, or so forth.
Right, and the mammogram is yearly.
Correct.
Right, unless they see something happening, it might be something that you have to do a second time before the year is ended, right?
Exactly.
We're talking about cancer. We'll be sharing information with our listeners about cancer. Does cancer have symptoms? Let us talk about that.
Yes, cancer has certain types of symptoms that you see in general with certain patients, or certain people, I should say. You see, for example, a person might start getting more tired, or they might start feeling more. Let me see. So you might say, wait a minute, I was feeling okay one day, but now all of a sudden, I don't know what's wrong with me. I feel like, I can't stay awake long enough, or I can't keep anything down. I'm just weak all the time. And not even just that. And sometimes it's just so subtle that you're thinking, maybe I've just been doing too much. And so and a lot of times it comes off as certain things. So it's so subtle that you don't even think, oh, maybe it's something bad. So it's like some of the top signs that you might see are, so in women, you might see some abnormal period or pelvic pain, indicating cervical, uterine, ovarian cancer. You might have changes in bathroom habits. So all of a sudden, you need to go to the bathroom every minute. Every minute, you'll have to have a bowel movement, or you have to pee, or you're constipated, or you might have black or red blood in your stool. These are all signs you look out for. Even if it may not be cancer, it may be something else. Right. Blood in your urine. Some people experience bloating. And bloating for more than 2 weeks can be a sign of ovarian cancer, as well as other gastrointestinal cancers. Then, with the whole breast, you might have new lumps. You might see dimpling. So what that looks like is, you see somebody dimple on their face.
Right.
When they smile, it could look like that on the breast as well, which means it's probably sticking to a tumor or something. So it's what they call lysis of adhesion. So the tumor will probably stick to the skin, and it's pulling it. So, different things. So changes around the nipple, unusual discharge, So if you
Mhm.
notice your areola, that's a dark part on your breast, starting to get just changing in some way, like it looks like it's getting more bruised, or it just starts draining, or it's just
Mhm.
more painful, things like that too. And the same kind of things with men too, the same symptoms.
Right.
Chronic coughing,
Mhm.
especially if it's very persistent, especially a dry cough can indicate lung cancer. You get
Right.
chronic headaches, so headaches that's lasting continuously.
Mhm.
um you can check to follow up with your doctor. It could be a brain tumor, but it could also be a possible aneurysm. It could be a wide variety of things. So if it might, like I said, it may not be cancer, but it may be something else. So you have problems swallowing. I'm like I said, these are all subtle things. You're
Right.
bruising all of a sudden. That could indicate something's wrong with your blood.
Right.
You're getting all out a whole bunch of infections. When you have cancer, your body is almost working against you, like it doesn't know which way to go. And so
Mhm.
it picks up infection so much easier.
Mhm.
Like you think about lymphoma or leukemia when you hear things like that, oral changes. So you're getting a
Mhm.
lot more sores in your mouth.
Mhm.
So this is especially in people who smoke or drink heavily.
Right.
So it can indicate various oral cancers.
Mhm.
And a lot of times on your skin changes, one of the big things people say is, that professionals use is this acronym called ABCDE, and it refers to asymmetry. So one half of the molar mark doesn't look like the other. So it's
Mhm.
different. Most times your moles are symmetrical.
Right.
The borders, so these things that pop up, the edges are irregular or blurred. The
Mhm.
color, so it's varied and inconsistent. So it's both black and brown. It's not one consistent color. The
Mhm.
diameter is larger than the size of a pencil eraser. So something that continuously growing and it doesn't stay in size. Like, so a mole that you're born with is going to stay the same size until you die.
Right.
If it's something else, it's going to potentially start growing.
Mhm. Mhm.
Something like, so it goes into the E part of it, evolving. So this
Mhm.
refers to any mole that grows, bleeds, or otherwise changes over time. Because like I said, it's going to stay the same way it is that it started off with.
Right.
You have persistent pain throughout your body.
Mhm.
These are all things you're looking for. Persistent fatigue. All of a sudden, you're lasting, you're changing energy level. No matter how much you sleep, you're still tired.
Mhm.
Also, after your postmenopausal, you're bleeding. You shouldn't be
Mhm.
having this. You may want to be checked. You want to check for your cervical or uterine cancer. Stomach pain or nausea.
Mhm.
Unusually, unusual discomfort that typically lasts more than 2 weeks can be a warning sign of liver, pancreatic, which is one of the most dangerous cancers you can have, or various
Pancreatic cancer. Mhm.
or various digestive system cancers. Because
The,
it's so hard to find. And then like unexplained weight loss and just like I said, unusual lumps. It don't matter if it's just on a breast or something, just anywhere in your body you find lumps that, and like I said, it could be nothing, but make sure you check to make sure it's not nothing. Because
right.
you don't have the background to understand what goes in the process of making sure it's nothing.
Right.
So,
Right. Does frequent infection in women, such as yeast infection, is that a possible subtle sign as well of cervical cancer or some
I
other
wouldn't
form?
necessarily say that it is. I'd
Okay.
more say, but it could possibly indicate a chronic illness, which we all know as a major killer to people, diabetes.
Diabetes.
So
Okay.
if as a woman you're experienced in a lot of that,
Mm-hmm.
then it's something you might want to get checked out,
Mm-hmm.
just to make sure that you're not early onset and there's things that you want to do to prevent things to
You,
happen.
there are some men who would say to me that they don't have regular bowel movements. Is this a cause for concern?
It is because you actually, I mean, some people, their normal is every third day,
Mm-hmm.
but that's their normal. And some
Right.
people, that's just how their body's been their whole life. But just
Mm-hmm.
because it's your normal doesn't mean it's something you want. If you're only having a bowel stay every 3 days or something like that, and even though it might be normal for you, it may not, like I said, it may not be cancer, but you typically you want to have at least 1 to 2 bowel movements a day. And if you're
Right.
not having one every day, that's also a reason to see your doctor and say, hey, I'm not frequent. And there's things that they can give you to help you be more frequent, because that means you're not eliminating your body's waste the way you should be. But that doesn't necessarily mean you have cancer. That just might be your body's norm.
Okay. Okay. Patrice, how does cancer drugs work?
Well, basically what happens is, which is why people get so weak, is they target your good and bad cells, and it's
Mm-hmm.
killing them. So that's why a lot of people who's in cancer treatment
Mm-hmm.
can't be around people who are sick, people
Mm-hmm.
who are, their immune system is so weak. Sometimes they become so, what you call neutropenic. That means you don't have the immune function to fight off certain things, so we can't even be around you. And
Mm-hmm.
so with me having been chemo certified at one point, we would have patients where you put them on neutropenic precaution, whereas even though I'm not sick, I can't just go into that room. I
Mm-hmm.
have to I have to dress a certain kind of way to make sure I don't bring anything into that patient's room
Right.
or around them. They're even limited to visitors, and
Mm-hmm.
you can't even bring them real flowers
Oh
because
wow.
something as little as that can bring in something to them.
Oh wow.
And so it's just a matter of just being mindful of certain things like that, because you know you this person, they can't fight it because of the treatments that they're having, and
Mm-hmm.
so that's why I think they're working on, companies, they're trying to work on target
Mm-hmm.
treatments for cancer where target specific cells, but it's something that everybody wanting to see who can develop this the fastest, because what means is that they can specifically target specific cells for specific type of cancer, and it kills those specific cells instead of killing all the good and bad cells in your body. So it leaves the good cells in order for you to help fight the cancer.
Oh wow.
Whereas with just chemo, radiation, all of that stuff,
Mm-hmm.
it's just killing everything in that specific area or throughout your body.
And this explains, because my next question would have been, why are we so afraid of chemotherapy? But this explains exactly why we are afraid of chemotherapy, because we're killing the good and bad cells.
Exactly. And
Yeah.
with cancer, it's so many different forms of treatment. Sometimes you have to do multiple ones just to get better. So they have what's called, like primary treatment. So that's the goal of the goal of the primary treatment is to not make sure, but to try and completely remove the cancer from your body or kill all the cancer cells.
Mm-hmm.
And so any
Mm-hmm.
cancer treatment can be used as a primary treatment. But the most common primary cancer treatment for most common types of surgeries of types of cancer is surgery.
Okay. Okay.
Especially if your cancer is particularly sensitive to radiation therapy or chemotherapy, you may receive one of those in addition. And then that's when you have what's called adjuvant treatment. So the goal of that is to kill any cancer cells that may remain after you have received the primary treatment. So say they do the surgery,
Mm-hmm.
they may do the surgery, and then you get radiation afterwards to kill the remaining, or to reduce the chance that the cancer will possibly come back. And so any cancer treatment you can use as that too. And so common adjuvant therapies, they include the chemo, radiation, and hormone therapy.
Mm-hmm.
Then
Mm-hmm.
you know then you have neoadjuvant therapy, which is similar, but the treatments are used before the primary treatment in order to make the primary treatment easier or more effective. So in some cases, they might say, okay, let's do radiation first. Let's do 10 treatments of radiation to reduce this tumor, and
Mm-hmm.
then we'll go in and do surgery,
Oh.
to avoid more issues. And then the next part of the treatment is another thing is palliative. And obviously, this is when the cancer has reached far stages. And
Mm-hmm.
so this is just to help relieve side effects of the treatment or signs and symptoms caused by cancer itself. So, like the surgery, radiation, chemo, and hormone therapy, those can
Mm-hmm.
all be helped to use. So even if, say, for example, you're at stage 4, the
Right.
doctors may say, okay, let's just do radiation and let's do chemo to reduce the size, try and help reduce the size of this tumor, so it's not blocking your intestine as much, so you can actually eat. Because sometimes, say, it depends on the type of cancer you have. Say it's a tumor and it's wrapped around your artery, they can't
Mm-hmm.
take it off, because if they do, you risk a high chance of basically bleeding out on that table.
Oh
So they
wow.
can't do it. So they'll probably do like radiation to reduce it, so that
Mm-hmm.
maybe you can even just put something in your mouth and swallow it. Because at some point you might not even be able to eat because the tumor blocking the food from going down. So all you're gonna do is throw up every time you eat.
Oh, so
So
that is what causes you throwing up because the cancer is blocking the food from really going down.
in some
In some
cases,
cases.
yes, yeah, in
Okay.
some cases, it depends on where the cancer is,
Okay.
but in some cases, it's just the nature of the treatment.
The treatment.
So the
Okay.
chemo itself, or even some people get sick from even just the radiation. But a big problem is the chemo. The chemo has multiple. When I say they have multiple side effects, they have,
Mm-hmm.
and some of them are horrible.
Mm-hmm.
And so even some of the treatments that you have, you might survive the cancer, but end up with issues with your heart. So
Mm-hmm.
that's the issues with not being able to have targeted treatment, targeted
Mm-hmm.
drug therapy. And so, the options for cancer treatments, goes to surgery, chemo. The chemo is used to kill, drugs to kill the cancer cells, radiation therapy.
Mm-hmm.
Is using like high powered energy beams. To kill the cancer cells, and this come from a machine that's outside your body, or it can be placed inside your body. It's like
Mm-hmm.
these little tiny beads. I
Mm-hmm.
remember one time I had a patient that and these patients, when they have the beads inside of them and
Mm-hmm.
they're at the hospital, you have to make sure that they're in lead lined rooms. So these are highly sensitive treatments, because you don't want the radiation getting to people outside the room. You have to
Oh
limit
wow.
going in the room, especially if your patients have these beads in them. They have to be on complete bed rest. And a lot of
Mm-hmm.
times I've seen this in patients with like uterine, cervical cancer. This is where they'll put these little tiny beads sometimes in the patients, and they
Mm-hmm.
call this brachytherapy.
Okay.
And so, at one point, I remember we had a patient, and they could not find one of the beads. Like one of the beads fell out into the sheets when
Mm-hmm.
they changed a patient or something,
Mm-hmm.
and because they know specifically how much they put inside of you.
Right.
And so, as tiny as they are, it has to be monitored closely, and they have us wear trackers to see how much radiation we've been exposed to. We can only
Wow.
go in there each shift, maybe twice. So
Mm-hmm.
you have to, and so these patients have to be alone a lot of times. So you think about all the other factors that are bothering them, and
Exactly.
so they literally had to go around trying to find this bead, because that it's a whole process. Your linen go down to the laundry chute, it goes to this. So they literally had to go around with this radiation wand to try and find this tiny bead that's as small as the tip of a pencil point.
Mm-hmm.
So
Mm-hmm.
just because of how much radiation is in that one tiny
Wow.
bead.
Wow.
So it's something they can't just say, okay, we'll forget about it. No, they have to know exactly specifically where it is to not expose other people. And so you have other things too, such as immunotherapy. So they're using your body's immune system to try and help fight the cancer. Then they have
Mm-hmm.
hormone therapy. So a lot of times you'll see people with breast cancer and prostate cancer, where they remove different types of help to remove these hormones from the body, or block their effects, that make the effects of them that may cause the cancer cells to stop growing.
Mm-hmm. Mm-hmm.
And they do have some drugs that focus on specific abnormalities within the cancer cells that allow them, that helps fight against them. The
Mm-hmm.
ones, that cause, but like I said, targeted drug therapy is a big thing right now. They're doing a lot of research on that, because if
Mm-hmm.
they can target each specific cancer cell, that would help patients' survival rates so much. And then
Mm-hmm.
they also have radio frequency ablation. And then
Mm-hmm.
they use it like electrical energy to heat the cancer cell and
Mm-hmm.
cause them to die. And
Okay.
then this is when a doctor puts a very thin needle through the skin, or through an incision, and
Mm-hmm.
into the cancer tissue itself. And then a high frequency energy pass through the needle and cause the surrounding tissue to heat up, killing that nearby cells.
Wow.
But that's, like I said, these are so fine-tuned treatments, and then obviously there's clinical trials. A lot of times you'll see patients stage 4 when they've tried everything else. This is the point where you'll see them at where they're like, okay, we're going to try this clinical trial. And as sad as it is, and you're like, okay, they're stage 4, they don't even know it's going to work. But how it is, how it's not going to work.
Mm-hmm.
And this is how they get drugs passed through the different phases. Unfortunately, it's the only way for us to know is to actually try it on people. But obviously, it goes through a whole lot of testing before it even gets to this point.
Mm-hmm.
So
Mm-hmm.
those are just the treatments along the process with that.
Wow, it's a lot. But tell me, does dieting, proper dieting, healthy eating, I mean, a vegan versus a carnivore, versus a vegetarian, can our diet save us from getting cancer or prevents us from getting
All
cancer?
right. So let's put it this way. If it's not genetic,
Mm-hmm.
yes.
Okay.
But if it is genetic, there's nothing you can do to prevent it if
Okay.
you're going to get it.
Mm-hmm.
But in terms of dieting, you don't have to be a vegetarian to be healthy, because I've seen vegetarians still end up with it because they weren't eating the right types of food. And
Mm-hmm.
being a vegetarian, not just vegetarian, just on a whole, you just want to make sure that you're maintaining or achieving a healthy weight. And
Mm-hmm.
so you want to have a what's it called, a healthy BMI, which is a body mass
Body
index. So you
mass.
don't want to,
Mm-hmm.
you want to kind of make sure it's under 25, and that will
Mm-hmm.
help to reduce your risk
How do
limits.
we?
At
How do we? Pardon me. How do we check our BMI though?
your BMI is, you're gonna, it's a little bit, it's a little bit of math to it, but a lot of times they even have like a the easiest way sometimes to just go online, and
Mm-hmm.
they have different tests that you can find. So a lot of
Okay.
times it includes your height in feet and inches, and then
Mm-hmm.
your weight, and then you have to just, a lot of times you could just plug those two in, and it will give you what your BMI is. And
Okay.
your
And
goal, underweight is less than 18.5. Your normal weight should be between 18.5 to 24.9.
mm-hmm.
Overweight is 25 to 29.9, and obesity obviously is higher than 30. So
I've
you kind of
heard.
want,
Go ahead. Sorry.
no, I was just saying, so you kind of want to make sure you kind of stay in between that
Mm-hmm.
18 to 25 area.
I've heard persons saying that they were told by their doctor that they're obese, and I'm looking at them because my own perception of obesity is, huge, and I'm looking at them, I'm like, what? You're obese and you're thin? So, so it has nothing. It doesn't mean necessarily that you have to be packing this visual fat
Right.
in an external way.
Mm-hmm. It's basically, boy, how to say it. Sometimes, it's, you're looking at a person, and sometimes the doctor will say, okay, your BMI says you're 26,
Mm-hmm.
but, you just carry your weight differently. Or,
Right.
so, I mean, I wouldn't necessarily be extremely strict on it. I'll just use it as a guideline. Just kind of
Okay.
make sure, the weight you're carrying is good for the height you're carrying. You know what I
Brilliant.
mean? So
Right.
so it's just a matter of just being mindful of that kind of thing, just making sure that you're just watching specific things like that, just watching what you're eating. So, also just being more active. Something
Mm-hmm.
as simple as just moving around more,
Mm-hmm.
making sure you're limiting adding sugars. So
Mm-hmm.
a whole bunch of
Mm-hmm.
sugars and candy and sweet and stuff. So like sugar sweetened beverages, highly, so if you're
Right.
drinking, and some people think juice is better than soda, but
Mm-hmm.
in reality, is it really better? Because if you look at the sugar content, sometimes some juice have more higher sugar content than soda.
Right.
So it's a matter of being mindful of how much sugar you put in your, even if it's 100, just make sure 100% juice, not from added concentrate. Drink a lot of water, you
Mm-hmm.
know. And then watch your calories. If you're
Mm-hmm.
watching your calories and just saying, okay, well, this is about how much calories I must have per day. People think it's like the worst thing in the world to do, but if you're monitoring how much calories you're putting in, you can monitor how much you can take off by working out and being more fit. And obviously, you want to include like vegetables, fruits, and whole grains. And then the big thing too is moderating portions of red and processed meat. So like steaks and
Mm-hmm.
burgers, that kind of stuff. But then also processed meats such as ham, bacon, and hot dogs and stuff like that.
Mm-hmm.
So just, you want to have small portion of meat. You obviously want the protein, which you can also get with beans and different things. But then you also need to have your vegetable, fruits, and whole grain. So a balanced diet is what will help, and not making sure you're adding. If you have to add it to your food, like you're eating some kind of fruit and you add sugar to it. So some people add sugar to their strawberry. You don't
Mm-hmm.
want to do that. You shouldn't be doing that. You shouldn't be adding any extra sugar to your stuff, to your food. And
Right.
a lot of people, especially vegetarians, you want to try and stick with plant-based proteins
Mm-hmm.
instead of just, like man-made protein. Try, and stick to, because sometimes I saw a lot of vegetarians or vegans will get, vegans obviously will more stick, do the plant protein one. But then also like tofu, for example, is a good protein, but the problem is it can mess with your hormone levels as well sometimes, or even like soybeans.
Mm-hmm.
Soybeans can mess with your hormone levels. So you have to just be mindful of what you're also eating. And
Right.
then obviously avoiding or limiting alcohol.
Oh, okay.
And then um things of that sort. Just, not drinking a lot of alcohol, and moderate amount of alcohol may increase your risk of some types of cancer.
Okay.
So, so no more than one drink per day or something like that if you're a woman, and no more than two. And obviously, this is all depending on like a half fluid ounce of hard liquor, or about 5 ounces of wine,
Okay.
or 12 ounces of beer. You have to get
Wow,
into numbers.
we have to go into the ounces now. So I'm going to the bar with my friends, and I have to be mindful of the ounces of beer that I'm going to have.
You know what? But that's the thing too. Just make sure you don't even, if it's not a daily thing you're doing and you're social, it's not a big deal.
Mm-hmm,
If it's not something you're
mm-hmm.
drinking let me drinking every day.
Mm-hmm.
It's,
It's just
you
a
know,
social thing.
exactly. If it's a social thing, you're okay. But
Right.
but mind you, again, social shouldn't be every other day. Or, some people take it
Right.
to the extreme and say, oh, I'm a social drinker, but you every day, every other day, on a going out doing something.
Yeah.
That's not social drinking. That's becoming a habit at that point. So,
All right. Let us wrap it all up for our listeners. Patrice, tell our listeners what is the bottom line? Cancer. What is the bottom line? What do they need to do? And let's wrap this up for them.
the bottom line, for helping to prevent cancer, the major thing is please make sure you're getting your physicals, seeing your doctors. Don't just blow off a stomach ache that you've been having for a while for nothing, for just indigestion. You shouldn't be having indigestion continuously.
Mm-hmm.
So anything negative happening to your body repetitively over and over and not going away needs to be checked out and addressed immediately. Especially I would use 2 weeks as my number mark. So if you've been having a specific symptoms for over 2 weeks, get it checked out. I'm not saying it's going to be cancer, but it's better to get it checked out. I know it's not. I know what to do, than not know at all. And when you finally get to go to the doctor because the symptoms are getting too bad, it turns out it's something worse. So it's much easier to get it, get your physical, get your proper physicals, and know what it is versus the unknown of what it could possibly be. Because some people are just afraid of the unknown. What if it is? But if it
Mm-hmm.
is, and you catch it early, you can do something about it. If it,
Exactly.
if you wait until forever to go and you find out it's stage 4, it's much harder to help, much
Mm-hmm.
harder to do anything for. So just think of it that way: temporary discomfort versus years of suffering. And it's not just you suffering, your family suffering too, because they're trying, they're a whole part of the process as well.
Okay. All right, there you have it, listeners. Patrice Labeach is speaking to us about cancer. You do not want to be in the unknown zone because of fear, because that can cause you extreme pain, ultimately death. So go out, get your tests done, and be in the known zone, because only then you can have a chance at surviving cancer. Do remember that nothing should be done unless it's done in moderation. I want to thank you, Patrice, for
You're very
joining
welcome.
us and allowing us to interview and sharing with our listeners.
Thank you for having me.
Listeners, join us next week when I'll be speaking with uh, a cancer survivor. You don't want to miss that show. But until then, thank you for joining us here on the Supreme Vibes Radio. This is the Inspirational Saturdays Show.